Hello everyone, welcome back to Urology Solutions _Dr. Vipul. In my last video, I had discussed about the lab tests that are usually needed for a patient suspected or treated for stones. Today, I shall be discussing about the radiology and the imaging studies. So, why do we need imaging studies for stone treatment or diagnosis? Well, the most important thing is to see and confirm its presence because there can be silent stones, non-specific symptoms, and lab tests which are suggestive but not confirmatory. So, to confirm the presence of stone, we need to see it, and that is where imaging studies come into play. Also, they are needed on a regular basis if I am planning to stop treatment and ensuring that the stone has passed out, or when I am not sure whether the pain or symptoms of patient are due to stone or other problems like appendix inflammation or appendicitis, ovarian torsion, ectopic pregnancy, or other causes of abdominal pain. So what does these imaging tell? First, they will tell a yes or a no whether the stone is there or not, and then they will further quantify the problem by telling where it is, how big it is, how bad is the problem, and what plan or optimal mode of treatment should it be. Also, they tell us when the stone has passed out and we can stop the treatment and need no further medications. Also, sometimes, as I mentioned earlier, patient coming into emergency with non-specific complaints, imaging studies are helpful in finding the cause of this problem. For example, cause of abdominal pain, one of which is stones, but there can be other reasons as well. Now, coming to the different type of tests. The most common tests being used are ultrasound and CT scan. However, X-ray and MRI are also there to complete the list. Let's talk about ultrasound first, which is the easiest, cheapest, widely available, universally present, and radiation free, hence safe in pregnancy. It is probably the most common test being done for patients of stones. It is good for repeated evaluation as it is free of radiation, and it is good for regular checkup for patients who are on recurrent stone formation habit and they need to do a regular health checkup. However, there are certain limitations. For example, if you see this, these are your two kidneys, this is the ureters and this is the bladder. Now ultrasound cannot see this part, it can see only the kidneys and the bladder. So a stone in the kidney will be seen on ultrasound, but a stone in the ureter cannot be seen on the ultrasound. Hence, ultrasound do miss stones in the ureters especially. Also, for kidney stones also, they depend mostly on the presence of swelling in the kidney. So, even if there is a kidney stone, they may be normal in early cases when the swelling has not developed. They are less accurate, hence not the optimal test for stones. So, what is the optimal test for stones? CT scan. CT scan is the most accurate test for diagnosing stones. It is currently the gold standard. It will tell whether there is a stone or not for sure. If CT shows stone, there is. If it is not showing, it is not. It will tell stone of all sizes, right from a small gravel or sand or dust to the big ones, all locations starting from kidney, ureters, bladder, even the urethra, and all stone types. It is also a good test when we are not sure it may be stone but other diseases like appendix or acute abdomen because it will do a complete evaluation. It is fast and easy. It also measures the stone density, which will help in determining whether we can use lithotripsy for stone treatment, which I shall be discussing in my future videos. Also, the risk or the fear that it is radiation exposure is there, but with the current new machines, the radiation exposure is also reduced to minimal. So it is perfectly safe even if being required repeatedly. Having said that, even if small, the radiation is present. Hence, it cannot be used for pregnancy patients. Also, it may not be as universally available as an ultrasound, not available in many clinics, many medical centers. Hence, needs a specialized center where it can be done and is definitely expensive. The other two tests being MRI and X-ray. Now, MRI does not see a stone. It sees the stone or makes a diagnosis based on stone-related changes in the kidney like inflammation and swelling. It is usually recommended for patients who are pregnant and we cannot do a CT scan and we are not sure whether there is a stone. Still, it is not being commonly done for stones in pregnant patients. The other test, X-ray, a very old test, earlier commonly done, now has fallen out of favor because it's grossly inaccurate. It can even miss larger stones, mostly being done as a complementary test to ultrasound to ensure that we are doing the stone diagnosis. So coming to the final point, what is the most accurate test? CT scan. One test which will answer all questions, CT scan. However, safest test, ultrasound. Test good for pregnant patients, ultrasound. Final word in a yes or a no, CT scan. If a patient has been treated, whether medicines or surgery, and is planned to stop treatment, if ultrasound shows stone, the stone is still there. However, if the ultrasound is not showing stone, ideally he should still have a CT scan done to ensure that the stone is gone and not lying in parts where ultrasound cannot visualize. That's all for this now. Keep following my channel Urology Solutions _Dr. Vipul for more kidney health videos, and stay hydrated, stay healthy. In my next video, I shall be talking about a very interesting thing, lasers, what actually they are and what the people perceive and their utilization in urology. Thank you.